immediately be one of the very critical things. But we have the information. We will go in to get the manifest to see who else was on board, who got out. So that's all going to be part of the mapping that we do before we start classifying them. So that's information we are currently retrieving to see.
Okay, so
because that's when you have the declaration from, when they came, what condition they were in, going through that. Even on the slot was the seat number. Who else was on the flight? Probably who was the closest person to him or on the flight. Those are the things you're looking for. Who was where those people who come out, where are they? That'll be the broader one. Then subsequently we'll do some mapping to see who has greatest risks, and then we'll classify them accordingly. But we'll follow all of them for symptoms until the period for incubation period is elapsed. Then we can say, well, if they don't get any complications, then certainly they are okay. But it's a median incubation period of 5 days. So the longer it is, the less risk it's involved.
Okay, but when you find these people, what are you going to do with them?
Well, normally we will ask them, based on the conditions, to ask them to self-quarantine. That's what we're doing now. We'll explain to them that's why you have come to them, the risks they pose to themselves and to others, and so they should do self-quarantine for the period, so that in the period that if they will also follow them up and see their clinical condition, whether they are getting signs and symptoms on daily basis, check the temperature among others to see that okay, until period is over. But when they do self-quarantine, what it means is that they are also not getting in touch with other people to spread the condition to them. So that's what we're doing.
Okay, but what about the immediate families?
Well, they are all part of the contract. So if you are living in the house with your spouse or your children, your family, they are part of the contract. So when we say contact tracing, it doesn't mean that you have to go far. I mean, they start from the people close by you, who are really available with you, the people who live with, you want to see, isolate them and protect them.
I was referring to because assuming you have traced the contact and you have asked the person to self-quarantine, is everybody in their home also supposed to adhere?
Self-quarantine means that you stay at home and you don't put others at risk, so you don't get too close.
Okay.
So that will include, most importantly, who closest to you.
So beyond this, what do you advise that the public would do?
The public still needs to observe the core preventive strategy we have for them, in terms of first ensuring that regular washing of hands, social distancing as much as possible, so that you're not shaking hands, hugging, and etc. And where we don't even have running water with soap, you can use the alcohol-based sanitizers to periodically be cleaning your hands. Don't touch your face. You should not also undue crowding. Crowding should be as minimized as possible, so that we don't create opportunity for viral transmission.
So our response team, how strong is our response team system?
When you have this, you already have some residual team because of past outbreaks. So they are there, the respiratory response team. They get retrained based on the new, because no outbreak is the same. So there are few nuances that you need to add specific for this particular case. You train additional people, you have it, and they train more, and that's what they are doing. They are training more. Next week we continue training a lot more across the country, so that as time goes on, we have capacity at all levels to be able to respond when they need it. So we have a team, we will continue training a lot more. We have received additional funding now to train more, provide more education for people, and also strengthen our infrastructure so that we're more ready for the next outbreak if it happens.
Okay, so yesterday at the meeting with the FBOs, I learned that mass gatherings, there's a conduit for spread.
Yes.
Is the Ghana Health Service going to take some drastic measures, advise that schools, public gatherings, and others be put on hold until further notice? Or what's the plan going forward?
We continue studying the system. For example, when you start having community spread, then you have a problem. When you have up to 1% of the population in the community infected, you have a big problem. I don't think we will want to wait till 1% of the population is infected, then you get into a surge. So as we study the condition, this is the first condition. If you start seeing any indication of community spread, which is where you have somebody who has not traveled anywhere, getting it and also giving it to somebody, then you know that we have a community spread. Under those, we need to bring out a few more systems that may include churches, etc. But we're also going to encourage people to ensure that these churches, etc., provide a means of regular hand washing to just in the situation. We may decide that to advise for stoppage or closure of schools to curtail transmission. So these are all scenarios that will happen. There are plans, we have the protocols for them, but as and when we get to the trigger, those actions will be triggered. But currently we are not there yet.
So what about the schools that have issued some kind of notice that they are going to temporarily close down until further notice?
Well, I mean, I'm sure those are private schools, and those are decisions that they are taking. It's also possible that there's a particular higher risk in a particular group or school than others, and so those. But as far as the public schools are concerned, those decisions, those advice, petitions, we have not reached the critical situation where we will suggest or advise such an action to be taken. But if a school feels threatened or feel that based on the circumstances that they are in, transmission is high and they want to break, I think that's okay.
Okay, so I think my last question is isolation centers.
Yeah.
How are they faring? Are they responsive enough? Since we put them together, has there been any need for improvements, or have we improved on them?
Yeah, we have a lot of centers across the country. Last week I met all the regional directors to do an evaluation of that. Nearly every region has on the average 2 or 3 centers. Some of them are ready, some of them will need some input and support. Unfortunately, the funds released by the government is going to be used to quickly update them, upgrade them to be able to be ready to do that. And we are doing this not just for this, we are doing it to build our capacity. And these things are going to be there to address other infectious diseases across the country. And so those holding centers and treatment centers are everywhere, all across the country. Some are ready, some will need some additional logistics and some touch-up to be able to be adapted.
So the two, how are they doing?
Well, I think they are all quite stable. There are not people who are critically ill, and so they are being taken care of.
You're not critically ill? I don't know.
No. They are all very stable. Very stable, and so we need to be cautious so that we don't develop any further escalation of their conditions whilst we monitor and give them the symptomatic treatment that they need.
So finally, have you, we were told that there was a branch meeting today. Are you advising any travel restrictions, and are you giving any
well, we've always advised that non-essential travels should be avoided. We told the traders who go out to trade and come in. Currently the government has put a ban on all public servants who, for not to do any non-essential travel, we need special permission to be able to go out. These are all systems that will be put in place. And we are also going to provide some education to ensure that maybe not people from affected countries who do not have any essential things don't travel here. So these are all suggestions that are being put out there to ensure that we protect the the integrity of our country and make sure that we don't import a disease into the country.
Okay, so sir, your final words to the public.
My final word is to stick to the preventive measures, hand hygiene, sneezing etiquette, social distancing. And this should not just be a 9-day wonder. We want this to be a practice. We want it to be part of us so that we avoid any transmission of infection from one person to another, and also keep everybody safe.
Thank you so much.